So I'm here with Donna, one of our favorite and most beautiful patients, as you can see for yourselves. Just kind of wanted to highlight some of the things we've been able to do for Donna, which include using fillers in, I think, in a very artful way, in that we've used them in small amounts over a variety of areas. So a small amount through the cheeks. We extend that very gradually into the temples, because sometimes patients will lose volume here, can look a little hollowed out. And then we'll complement filling the mid-face and lifting the cheek by putting small amounts in the nasolabial fold and marionette lines, versus putting too much emphasis there, which can weigh the face down. We really want to elevate the face, elevate the cheekbones, accentuate her already nice features. So that's a great use of Bellafill, and because those areas, although small amounts, add up to a fair amount of filler, we want to use something that's going to last a long time. Donna's only 67, and we want her looking great when she's 77 and 87. So Bellafill is the natural answer, because it will still be there. We may add small amounts over the future, but this is something she won't have to repeat over and over the way she would with other fillers.